Starting out as a nurse and being in the industry for 10 years in the hospital setting, I knew I wanted to change. I wanted to be able to help seniors in the comfort of their own home.
We ended up starting this business so we can help seniors age in place. Because going to a facility or a care home is not where everybody wants to be.
At Home Senior Services is a company that offers non-medical home care, companionship, and home health aides.
Non-medical in-home care is the ability to have someone that is skill-trained, just below a nurse level, come into your home and basically take care of you.
We do a nursing assessment. The first assessment is understanding what your needs are, what yours and your family's needs are. At that time, we then put together a care plan. We then actually find out if you need a companion, which does meal preparations, late housekeeping, whatever your father would need or mother would need. And then we would develop a care plan and move forward.
You want to make sure that the company that you're dealing with is one, bonded and insured, that goes to great lengths in hiring quality caregivers who are screened and then trained and then also physically drug tested to ensure that you're getting a quality person in that home. And we go to those lengths.
When somebody calls on the phone to our office and inquires about care, our next step is to come out to the home and do a get-to-know-you visit. At that time, the registered nurse would be there, and we can find out what is actual your needs for your loved one. If it's going grocery shopping or doing light housekeeping, we then develop a care plan depending on what you need.
The state of Pennsylvania in 2010 has required all non-medical in-home care companies to become licensed. And so we are a licensed provider in the state of Pennsylvania.
When we first start service, it's always scary for the client because they don't know who's coming into their home. We do, as a nurse, I do try to tell them, don't worry, they will become more of a friend than a caregiver. And actually what we find out is once we start service, it's harder for the client to let go of the caregiver when they need a day off or something like that because they now feel that she is a son or daughter.
Most people have questions regarding payment and what options are there out there for me. Well, there are some options. There is the Veterans Aid and Attendance Program if you are a veteran or a spouse of a veteran. And there's also long-term care insurance. Today a lot of folks have bought long-term care insurance. It not only covers what traditionally people would buy the insurance for was nursing home, but it also covers in-home care. And they have to read their policies carefully, but most of them do cover that now. And we are certified with a number of the long-term care insurance programs. At
Home Senior Services has helped clients to the point where they were confused, lonely, needing service, but did not want to make the step in having someone come into their home because they were scared. After meeting us and meeting me and developing a care plan to allow them to feel comfortable, we've seen remarkable differences, and families have told us that mom and dad have been doing great. We're to the point where they were going to go into a nursing home or assisted living, and with us there, we may be there 3 days a week, we may be there 2 days a week, but it really gives them something to look forward to, and we're there to monitor their everyday behaviors, whereas maybe sometimes they weren't taking their meds on time. And now that we're there, we've seen a lot of improvement with some clients that really helps keep them at home. The best way to contact At Home Senior Services is by telephone, 412-604-0410. And we would be glad to spend some good quality time on the phone to answer any questions that a potential client might need.